Like many other health systems across the country, we have experienced significant financial impact of the COVID-19 pandemic. We estimate the impact across UW Medicine is roughly $500 million. Well, we're taking a number of actions. The first is that we have reduced all the senior leadership compensation. We are reviewing all our expenses and reducing or eliminating any discretionary expenses. We are looking at all our capital projects and what can be delayed or postponed or potentially not done at all. And we are implementing hiring restrictions in all areas. We had to make a very hard decision that we also need to have some temporary furloughs. And so today we are announcing approximately 1,500 individual furloughs to our professional and non-union classified staff. We are also entering into impact bargaining with our relevant unions about furloughs for classified staff. This is a hard decision. We didn't want to need to do this, but it's critical that we do this to maintain financial stability. And we are preferentially taking more furloughs in the administrative and back office staff. We want to prioritize keeping our clinical staff and keeping our patients with the excellent care that we provide every day. Well, it's a combination of multiple things. The first is that there's lost revenue. So in preparation for a surge of COVID patients, we canceled all elective surgeries and procedures, and we also significantly reduced any care that could be delayed. The second is that we had increased expenses of caring for the COVID patients. So to keep our staff safe, we needed expansive PPE, we needed to expand our testing, we needed to add tents, we needed to separate our entrances. So there are many additional expenses that we incurred related to the COVID epidemic. And the third thing is there is the lost impact of growth initiatives and other changes we were planning to make that we had to put on hold while we devoted all of our attention to the COVID crisis. Number one priority for us is maintaining the excellent patient care that we do. So as part of this work, each hospital looked specifically at their volumes, they looked at their predicted volumes, and they looked at where we need to continue to have a regular number of staff, and where, because we have reduced volumes, we can temporarily have fewer staff, as well as what are the non-essential programs that we could put on hold for a short period of time. I do want to emphasize that we've seen a number of cases where patients delayed their care because they were nervous to come in. We have made this a safe environment. We want to let patients know that they shouldn't delay. The safety of our patients is our primary responsibility. So we are testing all inpatients and testing all surgical patients prior to any procedures. We are cohorting COVID patients. We have mandatory masking for all of our staff and patients and visitors coming into the hospital. And we continue to have a restricted visitor policy